Welcome, everyone, and thank you for coming. It's so good to see you all. I'm Allison Zippé. I'm a professor at the School of Social Work, and we're very happy to begin to offer a series of events focused on our MAP concentration, management and policy. And these are sponsored by the school's Center on Leadership and Management. And we so often hear from our students asking for more information about jobs, about career paths in nonprofit and public management. And we have a terrific panel of managers and MAP graduates here today who are going to tell you about their work. And this panel was assembled by Elsa Candelario, who's a professor of professional practice at the School of Social Work and a long-serving nonprofit manager. And Elsa is going to introduce our speakers. So welcome again, Elsa.
Thank you, Dr. Zippé. As she mentioned, I'm Elsa Candelario. I'm a professor of professional practice, and I'm very excited to be with the School of Social Work and able to organize a series of events with the Center for Leadership and Management with a focus on the MAP specialization. As I like to say, our MAP students are the future leaders of our profession. And so we'd like to, some of you heard the chat before this, and you know that it's important to kind of understand the breadth and the depth of social work practice. And so with that, I am going to introduce our first speaker, Pat McKernan. Pat started working as chief of staff for Gaudenzia in 2019. It's an organization that operates more than 100 programs in 3 states and Washington, D.C. In her role, she's responsible for overseeing all program operations at Gaudenzia, as well as quality assurance. Before working at Gaudenzia, she served as COO for Volunteers of America of Delaware Valley. She spent 23 years there providing services to individuals experiencing homelessness, individuals with developmental disabilities, veterans, and individuals who were leaving the criminal justice system. During that period, she was the president of the New Jersey Reentry Coalition, where she served in leadership positions for more than 15 years. And in 2014, she was appointed to the all important New Jersey Board of Social Work Examiners and currently is vice chair of the Board of Social Work. Dr. McKernan received her bachelor's degree from Trenton State College, which is now known as TCNJ, and her MSW and DSW from Rutgers University. She's published articles on the intersection of homelessness and prisoner reentry, as well as the effect of criminal justice debt and the need for reform. Dr. McKernan's website is wantedforwarrants.com, and it discusses the effect of criminal justice debt on reentry, such an important topic. Welcome, Dr. McKernan.
Thank you. Thank you very
Um,
much.
so I want to start with the question, where do you work? And tell me a little bit about what your agency does.
Okay. So, as stated, I'm chief of staff for Gaudenzia. Gaudenzia is a nonprofit organization that provides primarily substance abuse treatment services, both in residential and outpatient settings, all across Pennsylvania, Delaware, Maryland, and DC. My role is actually created for me when I decided to leave my last job. And primarily, my role is supervising programs and improving services, supervising the staff. We have approximately 1,200 staff that work for Gaudenzia. And so that my role here has been largely one of change management. I am currently at one of the sites, so I will talk as politically correctly as I can. But the agency was formed about 50 years ago, and was created in a time where treatment models were not as evidence-based as we expect them to be today. So a lot of what I've been doing is bringing all of the programs along with evidence-based practices, as well as aligning people with compliance, and that's why quality assurance is now reporting to me as well. So my role here right now is largely as one of managing programs, developing new programs, writing grants, and overseeing contracts.
So
That's in a nutshell.
you have a very big role in 1,200 employees. Just to contextualize that, that's a very large
Yeah,
organization.
it's a big organization,
Um,
and yeah. And and so my previous role was not dissimilar as Chief Operating Officer for Volunteers of America Delaware Valley. I was there for 23 years. I primarily, we were a service provider that attended to folks who were coming out of the criminal justice system, people who were homeless, people with intellectual disabilities, people with mental health issues, veterans, seniors. So we did a lot of variety of services, a lot of which was residential based. Residential services in human services is rather a unique field. If anyone on the call currently works in any kind of residential setting, you'll know that. So if you don't, it's not for everyone. It is definitely a different animal. But that work that I did at Volunteers of America was pretty broad based. And I thank you, Nicole, who gave a shout out for one of the articles that I wrote. The intersection between those populations is so powerful. And I know we'll talk a little bit about policy, but being able to have that vantage point of seeing how things intersect, and I'll give an example of it later, was really an opportunity for me to be the president of the Reentry Coalition. So that was work I was able to take our practical work, our direct service work, and advocate on a larger level for legislative reform and for lots of things, but legislative reform being one of them, but also improve practices with our funders and what have you.
So I'm going to kind of jump from what you've said as opposed to following some of the questions that I shared with you, because I think that this speaks to macro practice. The way that you've woven in research, evidence-based practices, the need for quality improvement, designing programs, changing them to make sure that they're aligned. Those are all important macro skills.
They are.
So if you could tell us how you arrived at a decision to become a macro practitioner and how you've developed so many macro skills in your career.
It's funny. I saw that question that, how did you make a decision? And I'm not sure that I ever really decided, that you sort of gravitate towards the things that you're good at. Those who know me personally know I should never be anyone's therapist, right? So those of you who have decided that you want to be part, that now you call it MAP. Back when I went to Rutgers, it was administration, policy and planning. I see Dr. Mayers on the call. He was one of my professors back in the 90s. Hi. I knew that being a therapist was not something that I wanted to do, and that was the right call for me. That's not for everyone. I say that all the time. I'm not a clinician. Some of my best friends are. No shame in being a clinician, but too many, I think, social workers gravitate towards doing clinical work and not seeing the connectedness to the larger social work mission. So for me, I wanted to be participating in and helping people. I wanted to help people. That was my initial, and I was already helping people when I went to get my MSW. I was working in welfare reform, helping women and families come off of assistance and find jobs and get into school. And then I went back for my master's in social work. I knew then I didn't want to be a therapist, but I also knew that I had really strong organizational skills. And when you have really strong organizational skills and you're a young social worker, you get moved up into management roles. And so early on, that's what happens. So when I have spoken to other classes at Rutgers of new students and said, who wants to run things? You're the MAP students, right? So people who see a vision for how a program should run, how an agency should run, how staff should be supervised, how you align an agency to serve the needs of a community. That's macro practice. Taking the lessons learned from doing that and parlaying that into legislative reform or into research that informs practice. That's how you further your voice, and seeing the connectedness. So some of the things that I've been looking at, you have to ask questions about how people arrive to your program or to your service or wherever you're working, and what are the contributing factors. And if we don't look into that, then we're missing an important lesson. So I think that, Elsa, to your question about how did I decide? I'm not sure that I decided. In fact, I think I remember at my MSW at the graduation talking to the MPA students thinking, wow, that sounded like a good idea. So, like, kind of happened into it. But because I was organized, and part of it is being bold. Find your voice, and when you see things and improvements that need to happen, when you work hard and you take on leadership roles and you're responsible, you will continue to move up, and that's how you build your own credibility and you build your voice. So that's I think, if that was a decision, it doesn't feel like a decision, it feels more like a journey. But being inquisitive and looking for the connectedness about what you're experiencing and what you think, how people are coming to encounter you and where they are coming from, and looking for those sort of root causes and about how you can contribute to solving some of those problems.
And so you've spent a good deal of your career solving some of those problems.
Like, so yeah, I want to talk about one, because I literally and I'm a data, I don't want to use inappropriate words, but I love data. I'm a data nerd. I read everything that people give me. I quote data, and people speak with your own voice. I'm like, that is my voice. I like numbers. I talk with numbers all the time. But so when I started with Volunteers of America in 1996, we were at our height of the prison population. The prison population in New Jersey. We know about mass incarceration. I can't imagine anyone on this call today doesn't know these words, right? We look at mass incarceration. The country, the United States leads the world in mass incarceration. And in 1996, New Jersey was on the trajectory up. By 1999, we reached 32,000 people incarcerated in the state of New Jersey.
Mm-hmm.
At the same time, New Jersey was investing in infrastructure of halfway houses and alternatives to incarceration, unlike the rest of the country, by the way. And what we saw was a significant return on our investment. Crime rates dropped, prison rates dropped. Now, part of the last, obviously, 6 months is related to COVID, but even before that, the state of New Jersey by 2020 had seen a more than 40% reduction in its prison population. That is not related to bail reform. Bail reform contributed to a 20% reduction in jail population. We know that when people are involved in the criminal justice system, it's very hard to get out. And so part of the other research that I was doing was about how people get stuck because of criminal justice debt. But those kinds of systems, working in that and seeing the core root problems of how people get caught up in a criminal justice system and how to help them stay out, that's work that I'm really proud of. And not only our individual work as an agency, working with people who are coming out of prison, as well as leading the Reentry Coalition on the larger legislative issues about not backing down. You don't close halfway houses before you close prisons. And in New Jersey, we've closed prisons. We can close more. We should be closing more.
Mm-hmm.
So that's to me I'm so proud of that work and being part of that work. Because New Jersey has a lot to be proud of. I always knew when people would say like, oh, I want to get involved in, mass incarceration because we're not doing anything. That's how I knew you didn't know anything about the topic, because clearly New Jersey was doing a lot of work. And we led the country in reducing our prison population for many years. So those are the opportunities when you decide to be part of a macro practice social work environment.
I think you raise a lot of good points, a lot of compelling points. In fact, just this morning, I saw a piece on formerly incarcerated individuals in Florida who are disenfranchised from voting and how that's such an important issue.
Right. And it compounds. So how many people per year are permanently disenfranchised, and what population, and who does that disproportionately affect? It disproportionately affects people of color. And so that the criminal justice involvement does not just mean one thing. And oh, by the way, the prison population right now is 15,000 people in the state of New Jersey. I just got that email.
Wow.
Because
Excellent.
I don't even work in the state, I still get the emails because I am nice to people and they still send me that.
And because you like data.
I love it.
So apart from being data driven, what other skills do you think social workers need to lead, and why is macro practice so important to our field?
Well, you are, whether you, if you are a clinician, you're still working within a system that someone else is creating, right? So to be clear, that the people who are leading your organizations, who are leading the advocacy efforts, are shaping the worlds that we work in. They're shaping the environment that you work in day to day. For us, in my last job, we were very data driven. I collected data routinely on everything: people, how many people we served, how many people successfully completed, and we're doing that now here as well in this organization. It's important for us, when people are not succeeding, you have to go look at root causes why. You see people who leave your program, what is the reason? What could be contributing to that? And so those type of analytical skills are really important in macro practice. But personally, just starting out as a new social worker in the field, it's the number one thing that will determine your success is working hard. There is no excuse. There's no hack. There's no getting around putting in the time, putting in the work. You can't read an article or take a class and think you're an expert. You have to go out and work with clients, work in programs, work in communities, and see what's really going on. Because what we learn as a particular narrative may not be what you see, and may not be what your clients experience. So there's no shortage, there's no way around getting that practical experience. So those skills are, and being inquisitive and being humble. You need to know that when you come into an environment, you are probably the person who knows the least about it. So you need to ask questions. So, and don't be afraid to ask questions. I am routinely the person sitting at the front of the meeting, raising my hand saying, I don't understand what that means, or I don't know, what does that word mean? Or what is that phrase? And where did you get that data? And who can I ask about that? Don't be afraid. One thing I've learned since I went back to get my doctorate is that researchers love to talk about their research. If you read an article and you have a question, you can Google anybody and you can find them, and you call them, they will talk to you for hours about whatever that they wrote. And trust and believe they're excited to hear from you. That has been my experience as well. When I called people about research and invited them to come out and speak in New Jersey, and they would. It was amazing. So be inquisitive, but be bold. There is, life's short. Be bold. Don't wait. Say like, I should have asked that person this, or maybe I should have made a comment or gave my own personal experience or whatever. Be bold and do it. Those things both, but I'm not suggesting speak without being informed. That doesn't bode well for anybody. But ask questions, be inquisitive, learn from other people's experience, and try to understand where they're coming from. Those skills are inherent to social work. That's who we are. But it is, for me, being bold and being informed and never stop learning is a key part of being part of a macro practice. And making sure that you understand and pay attention to the bigger picture and the bigger political environment that you're operating in. It's important because it does affect you every day.
Thank you so much. What about one tidbit that you wish you knew a long time ago? The advice is excellent. Be bold, ask questions. That's a lifelong process.
Yeah.
What about something that you
I'm trying to remember what my answer was. So I think it's be bold, right? Don't stop learning. I didn't go back to get my master's or my doctorate until I had been in the field for 25 years or more. So, and I was with some younger people that, had been only in the field a couple of years and I thought, but we all learn from each other. Never stop learning. Never, ever stop learning. Don't be afraid to ask questions. But, be bold or go home, because this, what we do here in social work, it's not for the faint of heart. And it's definitely not for people who think they know all the answers. Because we don't. We have to go learn it from the field and make sure that we share our experiences, and sometimes lift up the voices of other folks and give them the opportunity to share their stories that they may not feel comfortable with.
Very good. I so appreciate your words of wisdom, as I'm sure our students do as well. I hope that you'll be able to stick around until the end. We're going to hold our questions until the end. Thank you so much, Dr. McKernan. It's been a true pleasure to hear from you today.
Thank you.
Our next speaker is Amy Bertelstein Robles. Robles, who is also a Rutgers graduate. She's currently a counselor and anti-bullying specialist at Indian Fields Elementary School in South Brunswick. She's developed and taught the district counselor curriculum, teaches social skills and life skills to students in language learning disabled classes, and provides counseling. As the school anti-bullying specialist, she's responsible for complying with state and anti-bullying legislation and protocols. She's the coordinator of the building crisis response team and a member of the district lead response team. Prior to working in the school, she spent 9 years as the director of the Alliance for Teen Health Program. She wrote grants, created budgets, managed programs, and collaborated with various organizations. She also worked with the school-based youth services program in New Brunswick in its pilot year and continued there until she left in 1999. In 2018, she was honored to be the first social worker chosen to be the keynote speaker by district administration at the annual district-wide meeting for staff. Miss Bertelsen-Robles received her BSW and MSW from Rutgers University, and she was a math student and also studied abroad in Mexico City for 1 year. She's currently a member of the Middlesex County Traumatic Loss Coalition and a member of NASW. Welcome, Amy Bertelsen-Robles.
Thank you so much. It's great to be here, and I'm really glad that you're offering this for MAP students.
We're happy to have you. Can you tell us a bit about your anti-bullying work? You've had a very rich macro career. You're now at the school, and tell us a little bit about your anti-bullying work. And can you share how your practice as a macro level social worker has helped you with this?
Yeah, definitely. And I did make a lot of connections with Pat and some of the things that you shared about recognizing your own strengths and limitations as a therapist. And but I think that's part of the experience of being a student and having that life experience as well. So I was already in South Brunswick working in the schools for over 10 years prior to the legislation that was passed, the Anti-Bullying Bill of Rights in 2011. So this was a position that was assigned, I should say. So the anti-bullying specialist was an assigned position. It was not something that I needed to request, although I would have probably requested it anyway because it is an interest. So I really do need to adhere to the law, to school policies, district policies. So I have to be familiar with those laws and policies. I need to do my reporting. I need to collect data. I need to actually conduct an investigation according to state law and district policy. I'm responsible for coordinating the climate team, which is mandated by law as well, that each school have a climate team, which consists of a parent representative, our school administration, other teachers and other school staff. And what we do is I'm responsible for sharing out data, all of the information about prevention activities that we're doing. That team actually does come together. We're mandated to come together 4 times a year at least. We create and plan activities for students, staff, parents. So there's so many of these management and development skills that go into this, but then also, so I have the beauty in my position as anti-bullying specialist, but also counselor in the district, because I sort of use social work skills from micro, meso, macro in my position, which is wonderful for me. I always knew that I was more of the development and manager. I love to create programs. I love thinking about all those fine details when creating programs and managing programs. I work with lots of people who are big picture people who don't like to think about those details. I really like, if you plant an idea in my head, I'll take care of all of the details. I love it. So having to work with individual students as an anti-bullying specialist and actually conducting an investigation all the way up to, going to administrative meetings and doing my state reports, and everything in between. It's really a great opportunity. And I really do like being the person who is going to conduct the investigation. I'd rather me than anybody else in the school, because of the relationship that I do have with kids there, that I do teach lessons, I create curriculum. So I know what the students know, I know what information they have. And then when I conduct an inquiry or an investigation, I can really fall back on that and integrate that into my conversation. So my investigation is more like a discussion and conversation, which makes it more comfortable for the students. And already having a relationship with those students, I think, makes that process more comfortable for parents as well.
I think what better role than a social worker
Right.
to be the anti-bullying specialist. I'm sure that's not the case for all schools.
No, it is in my district, but I know in other districts there are administrators conducting those investigations, and teachers or people of different positions. So yeah.
Tell us a little bit about your decision to become a macro practitioner. It sounds like you're using all micro, meso, macro skills now, but for a very long time, you were engaged in macro practice exclusively and pursued the then MAP specialization.
Yeah.
So tell us about your own decision to become a macro practitioner.
So I definitely felt, I agree with Pat, I definitely did not feel that I was the type of person who should be a therapist. And I do remember, as an undergraduate at a BSW program doing my undergraduate internship at the School-Based Youth Services program at New Brunswick High School, working with UMD&J, UBHC clinicians, providing therapy to students through the school-based program. And I needed to work with a small group and with a clinician as part of my undergraduate internship. And I remembered saying to the clinician, I really don't have any business being in this room, because there should only be one anxious person in a therapeutic setting, and it should not be like the therapist. But I also hadn't been trained. I didn't feel comfortable. It just also was not something that I really wanted to do. But even with my work as the director of the Alliance for Teen Health in New Brunswick, it was that grant writing. It was that meeting with state professionals. It was running focus groups and needs assessment. But also the beauty was, as the director, I needed to work with creating programs for the adolescents. I needed to go to the health center with individual students and sometimes their parents, translate, while they're getting a tooth extracted, translating in Spanish, so it was that direct service. However, it was not therapy. So I think sometimes we as social workers and as social work students, we have an understanding without necessarily clarifying what's involved with a particular focus area. So again, I was administration, policy, and planning, which is MAPS. I knew I really wanted to do more community work, not necessarily only being an administrator, not necessarily only working directly with clients. I didn't know what that looked like or how that would turn out, but I feel like I have called my career riding the wave. You ride the wave, see what comes your way. Be careful about saying no to something too quickly, because I honestly, when I transitioned from my work in New Brunswick to my work in South Brunswick as a school counselor, my initial response to that invitation was, no way, I would never want to work in one building all day. I would never want to just work with one particular client all day. And I'm really, really glad that I learned more about the position. I, talked with lots of people. I gave it a try. I had nothing to lose. It was, as far as salary, it was pretty much straight across the board. And I ended up with summers off at the same level of salary. So It was amazing. But again, be careful not to say no too quickly, and find out information, ask questions before you make any decision, you know.
And is
Did I
there
answer the
anything, yeah, I know, I think that was a wonderful response. And it sounds like that's a good piece of advice. But I think I'll ask you, is there something that you wish you knew back when you were making a choice as a student to be clinical or math? Is there something you wish you knew back then that you'd like to share with our students?
I'll give you a piece of information that a professor shared with me. When I was struggling because I didn't know there was any middle of the ground. I thought it was either clinical social work or administrative. I didn't realize that there was anything in between. And I actually contemplated going into sociology instead, for that reason. I had a professor who said, think of it this way: when you're an administrator, you've got to learn and you've got all of those skills to work with people individually. So you can pretty much get your administrative degree and you could almost fall back on that other stuff. You can take classes if you want to learn more about the DSM, right? You're still a social worker, you're a licensed social worker. You can sort of hone those other skills at, at a later time. If you go clinical and you only focus on clinical social work, therapeutic, it takes a long time for someone clinical to work their way up to an administrative position. I had never thought about that. I never knew about that. So that's, I guess, what I would share. I did end up finding that out, but never would have known. And that really just kept me in social work rather than looking someplace else that I felt might have been a better fit unknowingly. And it's really true. I did actually end up taking a course when I went to, when I was hired in South Brunswick to be a school counselor. I did take a graduate level social work course through Rutgers to learn about diagnoses and DSM, because I felt that that was something that I really was missing. And it truly helped. I'm still using those skills, and but there's no doubt in my mind that I made the right choice. This is definitely for me. I'm proud to be a social worker. I'm very proud to be a Rutgers grad. And I think I have to agree with Pat that don't skimp on experience, because that is an investment. And there's a reason why Pat still gets those emails, even though she's not there. She said she's nice. And let me tell you that relationships go a long way. Really invest in those relationships, even if it's past the hours that you're supposed to be working or meeting or whatever it is. Invest in those relationships and those conversations. If you're not as bold as someone else, you can ask questions privately. You can, if you're not comfortable asking those questions in the front of the room, like some of us are, then you follow up and send an email later, or you have a private conversation with someone later. But definitely work on the relationships. It's an investment that will carry you over for years and years.
Thank you so much, Amy. We appreciate you sharing your wisdom with us, your experiences with us, and I'm sure that our students certainly agree. We know that you may or may not be able to stick around until the end for the Q&A, but we will send you any questions that our students have if you're not here at the end.
Please do. I'm sorry. I know it's a professional development day today at school, so I'm going to need to leave at 12.
All right. So our next speaker is Thirjeet Matharu. Thirjeet is the Senior Programs Manager at Wynona's House, which is a nonprofit child advocacy center. Wynona's House coordinates, at Wynona's House, she coordinates a multidisciplinary response to child abuse and maltreatment. Thirjeet has over 7 years of experience in nonprofit management that ranges from launching pilot programs, virtual fundraising, developing strategic partnerships, grant compliance, and volunteer management. She also teaches at Rutgers University as a part-time lecturer in the Graduate School of Social Work, and she volunteers at New Moon Films as a grant writer. Thirjeet received her Master's of Social Work from Rutgers University in 2016 with a concentration in management and policy. Welcome. We're happy to have you with us today. Can you share with us a bit about your work at Wynona's house and what you do there as the senior program manager?
Thank you so much, Elsa. At Wynyona's House, we're a nonprofit that works with children who are abused and neglected throughout Essex County, New Jersey. My particular role was something that was created to launch a pilot program. The agency was really looking to enhance their community outreach efforts and involvement. So this is really where I was able to launch a pilot program that involved around volunteers. In addition to that, part of my role also is with as a senior member or senior part of the team where we discuss different programs, how we can implement additional services that we need to really look at service gaps that as a macro social work practitioner that I'm able to assist with that. In addition to that, I'm able to, as you mentioned, the event planning. My role there is we recently conducted a comedy night that was a great success, and especially during the pandemic, a lot of our fundraising efforts were canceled due to CDC guidelines for in-person events. So part of that responsibility, again, revolves around community partnerships, strategic partnerships, and even discussing different opportunities and collaboration.
And how did you become a macro practitioner? Tell us about your decision and how you've used the skills you learned at the school within your career.
I think I'm going to echo everyone's sentiment where it
Mhm.
just kind of fell into your lap. I would say it was something I knew I didn't want to pursue clinical. I wanted to have macro impact and really touch the lives of in a group versus an individual. So that's really how it started. And I also knew I was someone really focused on detail, being someone that is looking into implementing and being someone who wants to lead. That's really how I think it fell into it. And as my supervisors were seeing this capability, they really kind of pushed me into those leadership positions.
And what are those skills that you think are needed by social workers to lead programs, to lead organizations? What are those macro skills that are needed or that you learned that have been really foundational for your work?
It revolves a lot around, for me, relationship building, whether it's getting to know my clients or the community that I'm serving. And from there, being able to, again, implement certain programs into the community. And I think also for me, some of the classes and even continuously that I've had to do is with grant compliance, where whether it's narratives that I have to provide to different funders, again, looking at the skills of even from a clinician or a clinical background where you're developing those skills in report building, and so that you can whether it's again soliciting to potential donors and funders with different efforts that we have.
Okay. And we do see that Wynona's house recently held an event on working with unaccompanied minors, which is certainly an issue that we've seen in the news quite a bit lately. In fact, I think yesterday it was reported that there are
Yeah.
545 children whose parents cannot be found, and I presume they were unaccompanied minors, or perhaps they were separated at the border. Can you share something about this event, given the current political climate, and share your perspective on the importance of policy practice in social work?
Sure. So this particular event was a part of our annual conference that Wynona's House produces, where we discuss issues of child abuse and neglect throughout the state, or I've seen it nationally as well. We realized this particular topic was sensitive as we've gotten some cases in New Jersey or in Essex County where we've had minors who have crossed the border, and the navigating the system, providing services has been often a challenge, as New Jersey doesn't necessarily have a policy revolving around unaccompanied minors. So this particular workshop was really helpful for our state workers, for particularly Department of Children and Families, law enforcement, how to respond when they are seeing these types of clients or cases. So we had a clinician provide or inform us of the different projects that they do and services that they provide. One of the organizations that we had was KIND, Kids in Need of Defense. A lot of these unaccompanied minors, unfortunately, do not have legal representation. And as you can think, who was a child who's very vulnerable and, you know, obviously doesn't know how to navigate the system, it becomes really, really traumatic for that particular child. So having these types of organization and, you know, pro bono services that these agencies are able to provide is really the root of, you know, the blend of macro and micro, I would say.
How do you know how many are in Essex County? How many unaccompanied children are in Essex County?
I do not, but I know for at least for us, being able to collect that data is also challenging as they're not very trustworthy of governmental associations. So hence makes it really, really challenging to even track that for us.
Right. I understand. And we certainly have challenges in counting all people who reside in the US, right? That's supposed to be the census, all individuals. So lastly, can you share with us one piece of advice for our students that you wish you knew or something that you'd like to share with them?
I would like to share at least two pieces of advice. I think the first would go back to relationship building or just relationships. I'll say when I was going through the Rutgers MSW program, having whether it was my classmates, whether it was my professors, and having continuously being in touch with them and their paths go into different journeys. And again, being able to connect with them because you never know when you need to pick up that phone call or have that similarity with that person. Or continue to. And then I think the other thing I would say is as advice, I know right now going through the graduate program or even as an undergraduate, reading those supplemental readings or reading any additional articles becomes really, really frustrating when you have obviously other class assignments or if you're working as a student. But as after the fact, many years after, I still continue to read those articles, and it's again having your finger on the pulse is really, really helpful. And this is really where, as a macro social worker, you're able to, you know, look at different practices that you have within your organization, how to implement our different new procedures, or even looking at, you know, research changes, things change, and continuously being up to date with trauma-informed or informed practices.
Thank you for sharing that. As a professor, I can appreciate that. Don't hold a grudge about the readings.
Yes.
We are continuous learners, and although we're developing those skills early on as students, we soon find that they do become habits, and we become, you know, continuous learners, continuous readers, and those skills will stay with you for a lifetime for certain. Thank you so much for sharing your experience. It sounds like you're off to a very exciting career. And we're really happy to have had you with us today. Hopefully you'll be able to stick around for the questions at the end. Thank you.
Thank you so much, Elsa.
Our next speaker is Veronica Estevez. Ms. Estevez has a range of experience, including working with at-risk youth, persons with addictions and mental illness, now as an administrator for Clear Conscience Counseling, which is a for-profit organization that offers services within the Children's System of Care of New Jersey. Veronica served as a program manager at Clear Conscience Counseling prior to becoming the facility administrator. She's currently the facility administrator, and in that role, she oversees the programming, operations, training, policies, and human resources of the organization. In addition, she's written policies that prepare the organization for obtaining licensure as an outpatient and as an IOP substance abuse treatment organization, and that's quite a heavy lift. She's also prepping her organization to secure licensure as a mental health outpatient provider. She earned her MSW from Rutgers University, and I'd like to welcome Ms. Veronica Estevez. Welcome.
Hi, everybody.
Thank
So nice to see so many familiar faces. This is so exciting. The new thing, the new way of meetings, right?
That's right. Thank you so much for being with us and for sharing your excitement. So tell us a little bit about where you work and what you do within your role.
Okay, so at Clear Conscience, I'm the Director of Operations and Facility Administrator. Our agency have about 800 clients. We have 3 branches. We have the Intensive and Community branch, where the therapists go out into the community to provide the therapy. We have the Outpatient branch, and we have the Intensive Outpatient. The difference between outpatient and intensive outpatient is the hours. So outpatient is usually once a week, for an hour or so, depending on the family's needs. But intensive outpatient is more for patients that have co-occurring disorders. So co-occurring is substance and also mental health. And they complete about 9 hours a week. In that, I supervise the clinicians here. It's about 10 of them outpatient. I oversee the clinicians that go out into the community. It's about 86 of them. I do have 7 interns, which I love them. No maps though, but no problem. I do payroll, so I do the hiring. I oversee the billing department, also quality assurance to ensure patients and also employee satisfaction. Case management department, I mean, you name it. I even make coffee sometimes and nobody else makes it. So, so I've been here 3 years, and I started as a program manager. And because of the classes that I've chosen during the MAP track, I was eligible to move up rather quickly. And I also, in my internship before I graduated, I was doing grant writings, and I was able to get them a grant for $10,000. So yay. So all of those leadership skills came handy when it came to selecting someone for the promotion. And that's where I am. That's what I do.
So tell us, it sounds like you're using quite a few skills, perhaps doing 3 or 4 jobs. Tell us about the most important skills that a social worker needs to lead, to be a leader in macro practice.
So I took Dr. Singh's class, and during that time, my last name was strategic planning. So strategic planning, definitely having a strategic vision. You have to be able to see where, as a leader of your agency, you want to take the agency. You also want to be able to, the planning part. I learned the 5 Ps. Proper planning prevents poor performance. So that's super important when you're in leadership. You also have to be adaptable to change and having like a learning agility, because you have to be able to change course and then bring your whole team and change with you. Motivation, the same energy that I have while I'm talking, I have the same energy and motivation with my team. So it's contagious, and nobody's saying like, oh my God, it's Monday. It's kind of like, no, it's Monday. And, our goal for today is, etc. And also being self-aware, having self-awareness, because as leaders, we don't know it all. And, you have to continue to be able to be mindful of yourself, your weaknesses, your areas that you could improve. And that kind of builds, with leadership styles, if you take the classes, you're going to know the different ones. But being adaptable. So when I can have a democratic leadership style, it's great for everybody. But at times I have to have an authoritative leadership style. And it's kind of like, this is where we're going, and that's where we're going that way, and explaining that to them. And also being comfortable with prompting people, delegating, and being uncomfortable with silence. A lot of times you have to hold other people accountable, and there's like this big elephant in the room, and it's kind of like, this is an area for improvement. Let's use it as a teachable moment, but moving forward, you can't do this again because we're going to have a different conversation. So just having like clear communication and just being sure of yourself. A lot of times it's a challenge. As a younger leader, if you would say Hispanic, Muslim, you put them all together, it's like the perfect medicine for microaggression. So you have to just be able to navigate through that and still be polite and still, I understand this is how you feel, but I'm at this side of the table, you're at that side of the table, and this is how we can move forward. So being respectful. And I would say with having some clinical background because of the social work program, then treat everybody like if you would treat a client and categorize them like the, stages of problem solving. And how do we problem solve? We first got to engage. So let's engage, let's get it out the room, and then continue to move forward.
Okay, well, you've covered a lot of ground in what you just shared with us. We should be adaptable, have lots of vision, take Dr. Singh's course so that we're
For sure.
learning about strategic planning, and apply those skills once we become professionals. Um, is there something that you wish you knew as a student, or a piece of advice that you would like to share with our students?
Well, I would say I wish I said at the bachelor's level. At the master's level is different. At the bachelor's level, I wish I knew there was a map track. I feel like a lot of students don't know that the map track is available at the bachelor's level. And I was able to find out about that option because when I graduated with my bachelor's, I didn't particularly feel like I was making a difference meeting with people one-on-one. So that's what made me do research. And I almost went to another school at Rutgers when my advisor, before I signed up to the master's program, said, you know, social work has a management and policy track. So I was like, oh my God, I didn't know. So that's something I wish I knew that I feel like everybody should be aware of at the bachelor's level. But as far as the students that are in the MAP program, make sure that you get an internship, that you're going to be exposed to HR, that you're going to be exposed to strategic planning, like everything that you're actually doing in theory, you can actually put it to practice, you know, with your agency. And also make sure that when you're doing an internship, you're actually maximizing the internship. And it's kind of like, let me be part of the meeting. Let me shadow you. Let me ask you a question. And make sure that they're giving you tasks that actually is going to make whatever you're doing relatable. I feel like the social workers in the clinical track miss a lot of things that are fair to the labor law and the labor market. For example, negotiating your salary is something that all of my friends that chose the clinical track didn't know how to do. If you take Dr. Singh's class, you'll learn how to negotiate your salary. And you know, it's just so much more to social work than doing one-on-one. Even though I'm at the director of operations for my agency, because I'm a licensed social worker, I also have a caseload. And having kind of like boots on the ground, I'm able to see what are some of the needs that the clinician needs or challenges that the clinicians at my agency might be facing with COVID. I mean, we're essential workers, so you still have to get out there. So how do you get out there? And, you know, so I came back and I said, oh my God, I need a policy. So I just went back and I said, okay, these are the questions that we need to ask. And this is how you proceed within the community. And this is what you would say. And this is what you would do. And, you know, we're always reviewing. And then, you know, now that we're transitioning back into a community, how do you transition the family? I mean, now everybody's used to the virtual. So how do we go to face-to-face? And then that's also a transition. So still being part of the clinical world helps me. And that's exactly why I chose macro, because the clinicians at the micro level, they're doing one-on-one. They don't necessarily have the advantage that I have. So everything that I see in the one-on-one micro level, I'm maybe able to bring it at the macro level and create policies to help that process.
You raised so many interesting points, so many important points that sometimes we don't have a roadmap, right? You were out there, COVID happened, and well, there's no roadmap. Where's the policy for that, right? Is there a model policy out there? And just needing to figure out how you're going to handle those issues within your organization, shutting down, opening back up when necessary, creating safety policies and practices. These are all really macro skills, but we don't necessarily have a roadmap. But what you learn in school in terms of planning, programming, facilitating, those are skills that help you through those uncharted territories, if you will. So thank you for sharing your words of wisdom, Veronica. I very much appreciate your perspective, and I hope that we are able to have you back at another time and that you'll stick around for the questions. Thank you.
Thank you.
Now we're going to hear something about field placement, which Veronica did bring up, how important it is to get those skills within field placement and to make sure that you become the busybody who's asking for important assignments, right? And so I turn it over to Marian Bischoff from Rutgers School of Social Work to share with us some words about MAP internships.
Thank you, Elsa. So exciting to be here today and hear about all the MAP career possibilities. So I'm the Management and Policy Field Coordinator. I'm going to share my screen with you just so you can see a little bit of what I'm talking about. Can you see it?
Yes.
Okay, great. So I have a background in engineering in the corporate world, and then I left that to get a master's in engineering. A master's in social work, and I did it in the macro track, which for me was called International and Community Development at my school. Had some different jobs, and now I'm doing this job, which I consider a type of a management or MAP type job in social work. So I absolutely love working with students, and I really like finding the internship that's right for you. Next year, if you choose MAP and you're a second year student, you'll be doing 22.5 hours a week. And so I wanted to just give you some ideas of what the internships can be like. I only have 2 slides. They can be small, medium, or large. You can be working for a nonprofit, a for-profit, a government agency. We have interns at federal and state legislative offices, policy offices, a pharmaceutical company, in criminal justice, in health and mental health, climate justice work, community agencies, schools, doing management, doing administration. And we do match your internship to your certificate program if you're doing a certificate program and you're in MAP. So then just to a little bit about what you might do at the internship could be needs assessments, program development, program evaluation, advocacy, policy development, volunteer coordination, project management, auditing, HR, strategic planning, grant writing, interagency collaboration, research, and sometimes working directly with executive directors, CEOs, or other upper managers. And you see my email address here. It's on the next slide as well. So feel free to contact me, even if you're not ready for a placement. And so these are some of the current MAP internships that we have. I don't want to read through them all, but I know someone said earlier that she's a data person. I need concrete examples. So that's why I always like to show students this. There's no guarantee of where we're going to be able to place you. We really work. I am the one who places all the management and policy students that aren't in a certificate program. And I work really hard to see what your interests are, what the skills are that you want to learn geographically. And so some of these internships were developed by students because they really wanted to work at an agency, and I'm totally open to doing that. So I think that's about all I have to say at this point, and I'll be around for the questions.
Elsa, do you mind me commenting? Marianne, I think that you and I have probably emailed over the years because I see my previous agency on this list. So we've all scrambled for MAP clients. You never have enough of them. I just want to give a really poignant example. I had interviewed a MAP intern, I want to say in 2017, and it was supposed to be a volunteer position. I had someone who ended up leaving. I called her before her internship started and said, would you come on as a paid position? And she did. She left her job, came on as a paid intern. So it was a work study. And the more because she was so talented and so inquisitive and was so such a good writer, her role evolved because of her skill and her acumen. I mean, just what she brought to the table, and was always willing to learn and always putting in the work and thinking of new ways of presenting data. So I kept adding things to her and promoted her. And then when I left, I brought her with me. So those folks, and gave her more money. So and brought her here for people to really see at my new job, what could someone with this background and this skill set do? And I think at first people were like, are you bringing someone on as your administrative assistant? Like, she's a master's level social worker. She's not my administrative assistant. And then here literally started in February, right before COVID hit, and we had to, when you run 100 different programs, 80 different facilities, and COVID hits, it's been a bit of a nightmare. She was the one writing our continuing operation plans. She wrote it was instrumental in getting a $1.8 million CARES package grant for us. I mean, MAP social workers are key function. They are key people in our organization. So, it's I can't say it enough, and I'd be glad to take more of them. They're worth their weight in gold.
I agree with that wholeheartedly. I ran an organization for a number of years, and they were the best students who also helped with marketing, social media, grant writing, data collection, quality assurance, you name it. My students were exposed to it. And I think, your field placement, you're there 22 hours a week. It's a fertile training ground, and hopefully you'll each have an excellent experience in learning these MAP skills. So now, thank you very much, Marian, for that. We're now going to turn it over to questions. And just so the audience knows, we know this was billed until 12 p.m., but we asked the speakers to stick around for another 10 to 15 minutes because we realized that it would be a little bit longer than that. So hopefully you'll stick around as well. Austin has been controlling the chat. And Austin, I wonder if there are any questions for the audience, or for the speakers rather.
A question from Rebecca. She asked, what kind of opportunities exist for a MAP social worker to have their own business in comparison to a clinician having their own practice?
Depends. It depends on what it is you're intending to do. Could Rebecca elaborate a little bit more? I would just caution you, if you're going to be doing any kind of clinical practice, you do have to have, or you're running a for-profit organization and you are doing social work, you do need to be licensed. So just to be aware of that. I know in the chat there was some other conversation about, licensure, and I just would encourage everybody to read your regulations. But there's lots of social workers that are able to start agencies. It's what they do. That's people do that all the time. There's grant writing survey. I know people who do grant writing. It depends on what it is that you would like to do. I would just, and I'm not trying to, and maybe this is me just being old, but I would really encourage people to get experience in established organizations before you think you need to start out your own business. Unless you have worked in an agency or worked for something and realize there is no one out here providing XYZ service and I can do it best. Because I would interview people all the time and be like, well, I'd like to start my own halfway house. And do you have any idea how expensive it is and how hard it is to open a residential program? It's not an easy thing. Veronica talked about getting licensure. Licensure is that's no easy process to get through. Even when you get through it, it's accreditation, and all of those things are very difficult and they're involved. So I would ask that, get experience and then make your decision about whether you want to be your own proprietor.
I'm sorry. I think first Dr. Zapay and then Veronica.
And Elsa, you may be about to say this too. We have another event scheduled for early December, and our speaker is someone, a MAP grad, who started her own organization agency. So she'll walk through the steps of that.
Right.
I was going to say that, even though we're MAP, it is super important. And I would always, always, always recommend that you get your license if you can, because it's just like one more tool to have under your belt. As a macro student, yes, I'm doing management, but I could open my own practice. I'm a manager. I can just hire the people, you have your vision for your agency and hire 2 therapists, and you don't necessarily have to be doing therapy, but you have your own business that you're managing. So it's just different options. But that license helps a lot. So just because you're MAP, don't kind of just put it off to the side. If you can get it, get it.
Other questions? Thank you.
Sophia, I've been questioning if a MSW was the right choice for me, as I feel like the program classes are very clinically focused. I'm interested in grant writing, environmental justice, and I'm unsure if I will get the proper experience. Any advice?
I feel like that's the beauty of social work. Social work is the one profession that you can wear so many different hats. You can be in collective bargaining. You can be, in labor laws. You can be in immigration, involved with immigration. You can be a case manager. You can be a quality assurance. You can do things that are not clinical, but for the sake of getting a job and making yourself more marketable, because it's competitive out here. Everybody's getting MSWs, and just because you have an MSW doesn't mean you're going to be hired. But if you just kind of like do a variety of things, if you know that clinical isn't your passion, then try to get more classes that are not so clinical and you still meet the requirements for the degree.
Or you could become a MAP student and take your electives that are more MAP oriented.
Question from Daniel. This is for Dr. McKernan. What motivated you to get your DSW after having a lengthy career with just your MSW?
I approached it the same way I did the MSW, like it just happened. But, personally, my son was going to be graduating high school in 3 years. And I thought, if I'm ever going to do it, I need to get it done now before I have to pay for his college. So it's like real driving force. I think I reached a point in my career where I felt like that I had kind of done that. I had been doing the work for more than 20 years and what have you, and felt like I wanted to write. I wanted to get published, and I felt like I had a voice, but I wasn't sure how to make that happen. The DSW program with Rutgers, I was technically a clinical program, and I'm not a clinician, but it wasn't, there was a very strong writing component to it. The way it was constructed before, I'm not sure about it now. But that they were really helping you to present data in a way that was useful and accessible, and that was compelling to me. I had looked at other programs, but I thought that one was very manageable with a full-time career, as well as being on the board of social work and being involved in other advocacy issues. So it was manageable for me, but it was a little daunting because it's a cohort of 20, and they were all clinicians other than me. So I think, and I hope that I brought a different perspective, and I learned from them. It informed my work on the board of social work as well. In hearing, what clinicians, some of their perspectives, and that was interesting for me. Honestly, the DSW did not, for me, it didn't matter. I'm not trying to diminish the importance of it, because I like it. I had a great time in the program, and I learned a lot, and I learned how to write and present data in I think a more meaningful way. For a lot of students that I graduated with, they parlayed that into other teaching opportunities. But for many of us, and then for some of the clinicians, and this isn't really necessarily for this group, but for some of the clinicians who've been working with other peer professionals, other psychologists or what have you, it felt, I think, for them a validation of their clinical skill. So, although I will say for DSW, a lot of universities are really looking for PhDs. So the DSW is becoming more and more accepted, but not universally. For me, in a macro practice, for real, sometimes I think it just gives you a little bit of cred. And I think Noelia, who was emailing, asking me about titles, Dr. McKernan is when someone's in trouble. That's when I come in, and she's Dr. McKernan wants to see you about this. And it's like, come here. We're going to sit down and talk about compliance. So, those are, it was on a personal level, it was really validating. I hadn't been in school in 20 years and feeling like, part of a learning environment. It was really exciting. But I think I got more out of it because I had been in the field as long as I had, and I'd been out of school. If I had gone like right after my master's degree, I don't think that I would have been able to have the same experience. I think that lived experience of being a social worker, working in tough to serve communities, I think that gave me a different opinion and a different scope of, of what I wanted to look at. The connectedness, I did want to make this comment, Elsa, I apologize, because one of those things you had asked before about, sort of the connectedness or lessons learned, you have to look for that connectedness, because you may be passionate about this one thing and you don't realize that it's connected to something else. When I first started out as a social worker in the early 90s, Many of you were just probably being born, but that's a different story. So in the early 90s, there was a big push toward welfare reform, right? Helping, getting people off of assistance or what have you. And I was really, really proud to do that work, working with, especially as a women identified, largely I was working with women, helping women where they were, women who were struggling with lots of issues. And poverty is a real area of study. And it was really difficult to sit with other people's pain and to see what people were contending with. When I left, I worked in that for 6 years, and I kept thinking in my head, because a lot of the women were on assistance because they weren't getting child support, right? They had dependent children that they weren't getting any support for. When I left that job, I went as a 27 or 28-year-old, kid to go work and run a men's halfway house. And the first time that we had family day, I saw my clients come back in and visit the men at my halfway house. And I understood the connectedness that when you remove fathers from families, what happens to those families? Not that, I'm not suggesting that every woman who was on assistance had a person locked up, but there is that connectedness there about poverty and what happens to communities and that what those families go through. And so to me, I didn't want to lose sight of that. It was jarring going from working in a women's identified, program to running a men's halfway house, where the very first client said to me, "Who are you?" And I said, "Oh, I'm Pat McKernan, the facility director," and tried to shake his hand. He's like, "I don't shake women's hands." It's like, where am I? What year is this? So, you have to connect those experiences to understand how to interact with people in a meaningful way. And I don't think I would have been able to get as much out of any other advanced degree without having some real world experience. So I just wanted to offer that. Those are the things that you're going to look forward to when you get a job. And so I know that someone else asked, how do I get this experience? Start working, get your internship. I've had students email me now, and I don't know what Rutgers policy is, but students are like, "Well, I'd like to do a virtual experience." I don't do virtual experiences. We are all working. During COVID, I said 80 facilities, we never closed the doors. And that was an enormous undertaking for those of you who are also working. Not to close the doors and still accept admissions during COVID was an event. But everyone's looking for, there's always vacancies in agencies. You have to start someplace, and you've got to get the experience. So start looking and think about what it is that what your passion is.
Thank you so much, Pat. Amy has one comment, and then we'll be wrapping up with her event.
Just to build on that too, that it, get the most out of your internship, get to know people, talk to people, look for jobs, get out there. I would also suggest, even as students, you can attend webinars, you can attend conferences, you can attend workshops. And while you're there, talk to the people around you, listen to conversations, observe, make those contacts, network, learn while you're just attending a workshop, So there's lots of opportunities to get to know people and learn more.
And if I may, Elsa, really, less than 15 seconds.
Go ahead.
I just wanted to say for like recent graduates, like Dr. McKernan was saying, just get out there in the field. I mean, we all want to see that doctor behind our last name for sure, but it's more realistic to get out there, get a job, and then later on consult with one of your professors. Even though I graduated like 3 years ago, I still keep in touch with Dr. Singh, and just consult with your professors or anybody at the agency. Like, what do you want the PhD for? What exactly do you want to do with that PhD? Or is it something that you just want to say doctor? Because if that's the case, I don't know for many of you, but me, I was just trying to get that MSW so I can start making money. I was so broke as a student. So I'll start making money and then pursue your PhD. But like Dr. McKernan say, get that experience, because you have time to find out, okay, what do I want the PhD for? Is it a personal achievement because I want to achieve self-actualization according to Maslow? And when I get to that doctor degree, I'm at the tippy top of that pyramid and I've done it. I did it. Or is it just because, oh my God, without the PhD, I won't go anywhere?
Nobody paid me extra for getting a doctorate, that's for sure.
No, you paid for it.
I paid for it.
Okay, well, thank you so much to our speakers. I just want to wrap up. This has been just amazing. I can't wait until the next one. I really thank you for your generosity of time. No one got paid big bucks for today. So I do appreciate you paying it forward and sharing your wisdom. I'd like to remind us that we had advice to be bold. We had advice to not say no too quickly from Amy. Thirjeet asked us to be continuous learners and to continue to read despite doing so begrudgingly as a student who is overwhelmed. And Veronica asked us to be adaptable and to use all of our tools as we engage in vision setting as macro practitioners. And we can start all of those things right now. Thank you to each of you and enjoy your Wednesday. Happy Wednesday. And
Thank you,
remember to vote.
Thank you.
Thank you
you.
all. Great to see
Bye,
you.
everybody. Thank you.
Bye-bye.
Bye,
Thank you.
everyone.